So for the purpose of your step one, just know that your source of cytokines, two main sources coming from the innate arm of the immune system as well as the adaptive arm. And for each arms, whether the innate or the adaptive, you have just focus on one cell for each of them, for one cell. So for the one cell here, macrophage. Okay. For the one cell here, CD4 T cell. Okay. That's this one here. All right. So now just one cell in the innate up here, one arm in adaptive, one cell rather in adaptive. That's your CD4 T cell. All right. Okay. So now we'll talk about the the action. So we're moving on to the action. Now I said when you see interleukin, now I use a different color for them. So when you see 1, 6, TNF, these three almost always go together because they almost always carry out the same thing. The same thing. The only thing unique to 6 that you need to remember is the acute phase protein. Okay, so we're dealing with 1, 6, and this. So let me show you. Let me show you a picture. So this is what the diagram I want to show you. So this is all 1, 6, and TNF. Interleukin 1, interleukin 6, and TNF. So they all carry out this basically the same function, the same activities. The only thing that interleukin 6 does that is different is acute phase, which hell, like you can see here. So it's almost they all do the same thing. Just think of it that they're all together. The three of them. Just think of it like the Three Musketeers. I don't know if you've ever watched the movie or read the book of the Three Musketeers, but they're the ones that were causing havoc for the king, going around. They're like a band of brothers, one for one and all for one. So that the three of them always act together. So if you look at the action, you can see here they activate white blood cells, okay, to go and fight infections, okay, to go and destroy infections, right? Then number two, you can see here, they stimulate fever. So they'll go to the brain. When you have an infection, they'll go to the brain and make the brain, the thalamus, and make it set. Well, just know that they stimulate fever. The acute phase proteins, all right? So you're talking of C-reactive protein, you're talking of fibrinogen. Just nothing too important now, but once you get to hematology or even pathology next week, we'll have more details about the acute phase reactants. Okay, those acute phase reactants and why are they important? Why is this acute phase important? Especially when you're dealing with in most inflammatory states, if you've heard of ESR, erythrocyte sedimentation rate, it helps to when you're doing it in the clinic, you'll say, oh, okay, why are we evaluating ESR? When the ESR is above, I think 20 millimeters per hour or so, that it's higher, but you evaluate it because to tell you this patient he has a inflammatory condition going on in the system. And these are the cytokines that are behind it. So they go to the liver, stimulate the acute phase reactants. We'll discuss how the process of how this acute phase reactant leads to an elevated ESR, all right, in chronic inflammatory conditions specifically. So, and then you go to the bone marrow and stimulate leukocytosis, all right. So when you have an infection and then you do a CBC and then you see leukocytosis, all right, these interleukins are the ones responsible for that. Fever, all of that, they're the ones, they go to the heart too. So these are all part of shock. Some of the things they do here are part of shock, all right? Also stimulate thrombus formation, insulin. So these are a lot of the effects they carry out in the body, all right? So you can see here, those are some of the things I talked about here: fever, acute inflammation, right? This induce other white blood cells to secrete chemokines. Now, when you hear chemokines, there under the cytokines. So if you have your cytokines as a broad umbrella, let me write it down here. So if you have your cytokines as a broad umbrella of a communication molecules between cells, all right? Under it now, you have other subsets within them that stimulate different subgroups of cells. So first one, you talk of chemokines, okay? Another group, you talk of interferons, okay? Another group, you talk of interleukins, okay? Another group, you talk of interleukins. So this is where you find the interferon alpha, beta, gamma, right? And then the chemokines. So when you hear chemokines, first of all right, the word comes from chemical, this chemo, from chemicals, kinds, kinetics. So chemicals that stimulate cell movement, right? There are chemicals that stimulate cell movement, right? That's the chemokines. So when you hear, when we get to particularly, they are very important in inflammation. When we get to inflammation pathology, inflammation, and they tell you, okay, you have your blood vessel here, right? You have the blood vessel here, and then your white blood cells are floating around here inside the blood vessel. And then you have a pathogen that's outside in the tissue, okay? And it's causing a lot of problems, damaging the cells. So something has to alert the white blood cells to move from inside the blood vessel outside to come here and attack the pathogen, okay? And that signal that stimulates them is what is called the chemokines. And we've come across one chemokine already, right? We've come across one already. So if you come here, your C5A, right? Okay, C5A is a chemokine, right? Stimulates neutrophil chemotaxis. So when you hear chemotaxis, the cells come out, they are moving from where they are to where the problem is. So you see here, they are inside the blood vessel here, and then they have to come out of the blood vessel and then move to the source of the problem. So that is called chemotaxis, and the chemicals that stimulate that are called chemokines. All right, they are called chemokines. So now we'll look at them individually. Okay, so we're talking about we're still talking of interleukin 1, 6, TNF. So we said they do everything together. They do almost the same thing, everything together. So like I said, interleukin 1, fever, interleukin 6, acute phase reaction, all right? Then tumor necrosis factor. So when you look at tumor necrosis factor, when you hear this cachexa is just means, so what, before I get to that, so what are the things we said that interleukin 1, 6, TNF do? Fever, acute phase reaction, what was the other thing? Leukocytosis, activation of leukocytes. When they say activation of endothelial cells here, right, it means it's this process that we said here of this process we talked about of the white blood cells. This is a neutrophil. So the process of the white blood cell, of the neutrophil or macrophage or any of the white blood cells moving outside the blood vessel to where the problem is. Note, this is inside and this is outside the blood vessel. This, okay. So this, for that process to happen, the endothelial cells will be activated, and then you can see they are creating spaces here. So they have to activate, they'll be activated, and then they'll move aside. Like they initially they were forming they need to form a barrier so that blood doesn't leak out into the tissue. All right. But then when they become activated in the presence of an infection or injury, then it sort of gives space. Right? You can imagine maybe you have, if you've ever watched all these protest videos on news where people are protesting and the police come, they form a barrier and prevent the protesters from moving any further. You can look at it like those endothelial cells. That's what they do. They form a barrier, prevent cells and blood from inside the blood vessels from leaking out. But anytime they're activated, they'll give a space, all right, so that the white blood fluid and the white blood cells can move out of the blood vessel into the interstitial spaces or extravascular space and move to where the infection is. So that's what the and this is all stimulated by the interleukins 1, 6, and TNF alpha. All right, so those are some of the things. And then we said fever, we said leukocytosis, we said acute phase infraction. So those things are very important. So please remember that. Then so that's what they are talking about here, activates the endothelium, which will now lead to leakage of the blood vessel and also recruits white blood cells. So they all do the same thing, the three of them. So now looking at TNF alpha specifically, this all of this is normal because it's supposed to happen. If not, the white blood cells will never go to where the infection is. The body will never respond to an infection. Okay. And then that pathogen will do whatever it needs to do it'll be damaging the body unchecked. Now there are conditions where TNF alpha is secreted pathologically. That's the pathologic conditions where TNF alpha is overproduced and it now leads to a lot of problems such as weight loss of muscle mass, low appetite, all of that. So we're talking of cachexia. Okay. That this happens in malignancy or chronic inflammatory conditions. Okay, or chronic inflammatory disorders. So, like we said, the and part of the reason for that here, this cachexia is the person will lose body fat, right? There's a reduction in body fat and muscle mass. Okay. Part of the reason for that is low appetite. It's just low appetite. The person doesn't want to eat much, so he's losing weight because he's losing body fat and muscle mass. Okay. Then the other reason, like I showed you here, if you see here, particularly here, where we said it goes to the muscle and stimulates insulin resistance. So when it stimulates insulin resistance, it simulates a diabetic condition. Makes the things look as if it is in diabetes. Okay, because when we talk of diabetes, we're talking of insulin. All right. But what that just means is the muscle can't take up, the muscle needs insulin to take up glucose. And if the because of the cytokines, you can see here, they are blocking the action of insulin. So if they block the action of insulin, the muscle can't take in insulin, and then it starts breaking down other things, fat, proteins. If when we get to biochem metabolism, we'll see that one of those conditions where glucose metabolism is disrupted, the body has to find other sources of energy. So to turn to fat, okay, and protein. So once this is produced over a long period of time, it will disrupt insulin action in the muscle, and then the muscle begins to break fat, and the body begins to break fat and protein. So that's what leads to your low muscle mass and low body fat that is characteristic of cachexia. So when you see people that have malignancies, advanced cancers, you see them, they start losing weight, they dry up, okay, they look like a child, they look like someone with marasmus. When we get to metabolism, they look lean and wasted. Okay, you can see the temple goes in, their eyes are sunken, their cheekbones become prominent, their collarbone the rib cage is prominent. Okay, so all of that is due to this cytokine that is overproduced because the malignancy is an abnormal condition. The body is trying to fight it. It sends the body into an chronic inflammatory state, and that as a consequence of that, you lose a lot of weight. So, And then also, tumor necrosis factor is involved in granulomas. So when you see granulomas, the most important for step one, I want to think two main conditions for granuloma. You talk of TB and sarcoidosis. Okay. There are other ones. There are other ones that you when you get to micro, but for the ones that they will give you a slide, an image in the exam and tell you, okay, what is this? What are you looking at? Right? TB and uh, what do you call it? TB and sarcoidosis. So this is a granuloma, right? This is a giant cell here. Okay. So if you look at this, this is your giant cell. Okay, you can see the multiple nuclei here. Okay. Once you see this, like a necklace around the neck, okay, they call this a horseshoe. Horseshoe. When you look at a horseshoe, all right, that's semicircle because they are arranged in a crescent shape. Those are the nuclei. So, but that's a giant cell. These are your lymphocytes up here. Okay, these are your lymphocytes. These are other macrophages that have been activated by the TNF. All right, but TNF is not the most important one. When we go down, we'll look at some other two main cytokines. And once you think of them, talk of TB especially. All right, so these are your macrophages here. Okay, all these ones, these are the nuclei of the macrophages. So this is the nucleus here. Okay, and around it is the cytoplasm. This is another nucleus with the cytoplasm. So what's going on here? When the macrophage has been activated by CD4 positive T cells, right? That's what am I talking about? Let me go back and show you. So this macrophage leukocyte CD4 positive T cell interaction. Okay, so once the Th1 cell, right, particularly here, the macrophage picks up TB as an antigen presenting cell, brings it to the macrophage, the CD4 T cell will be activated and then stimulate the macrophage to go back and kill the TB in the lungs. All right. That's what this whole stuff is talking about. The interaction between macrophage and the CD4 positive T cell. So once that interaction is what is very important for TB, as we'll come to see. So once the TB macrophage goes back and it can't kill, it's trying to get rid of the TB. It literally does what you. I don't know if any of people have watched this child cartoon we used to watch as children, Voltron, where you have they're trying to fight an enemy and then the team will combine into this giant robotic monster robot that will fight the monster. That's what the macrophage literally does. So you see these individual macrophages, they'll join together like Voltron, okay, and form this giant cell here. So the giant cells, because multiple macrophages have combined to fight the TB or whatever pathogen that you're trying to get rid of. All right. So that's what gives rise to the giant cell. So this is another granuloma here. See, there's a giant cell here. All right. There's a giant cell here. And then all of these are your macrophages, the nuclei of macrophages. These are your lymphocytes. These tiny dots are your lymphocytes. All right. Then within, you can see the boundary here. So this here is your lymphocyte. Your lymphocyte, these are your macrophages. Okay. This is your giant cell from macrophages. All right. So the macrophages combine like Voltron to fight the pathogen that they are dealing with. Okay. So when they give you this kind of image and they describe, okay, it's macrophage and CD4, and then they'll mention some interleukins, or they'll say what kind of interleukin stimulates this. We'll discuss that very shortly now. Okay. So, but TNF is one of them. Tumor necrosis alpha is one of the cytokines that mediates that. And like I said earlier, TNF, interleukin 6, and interleukin 1, they almost always go together. And then it's mediated in fever and sepsis. right? So when you talk of sepsis, what are the things that stimulate sepsis? We talk of gram-positive, gram-negative cocci. Gram-positive, gram-negative cocci. So for gram-negative, remember we said LPS in the gram-negative binds to toll-like receptor, okay, on the white blood cell, particularly the macrophage here, okay? And once that macrophage sees the LPS via the toll-like receptor of the on the macrophage, it will start producing those interleukin 1, 6, and TNF alpha. So if you look at, so this is your macrophage, okay? It has the toll-like receptor here, all right? So once your LPS binds to it, all right, this receptor becomes stimulated. Once it becomes stimulated, it will now activate NF-kappa B, all right? Once it activates kappa B, this will now go to your DNA and stimulate gene transcription, all those processes that make the macrophage to now produce your cytokines. That's interleukin 1, interleukin 6, TNF alpha. All right. These are the things that will now go on to stimulate all those effects we looked at that will lead to sepsis. All right. So you have your gram negative bacteria with the LPS stimulates the toll-like receptor on the macrophage, which leads to production of interleukin 1, 6, and TNF alpha. And then all those things stimulate sepsis. So when you talk of sepsis, you're just talking of fever with hypotension, okay, low blood hypotension, okay, that reduces blood supply to the vital organs and the tissues of the body. So that's what happens in sepsis, right? So if the question tells you about a patient who had an infection, now went to the fever, hypotension, and they had to admit with IV fluids, you know that one of the cytokines, the three main cytokines are involved. One, interleukin 1, 6, tumor necrosis factor. Okay. So, all right. So that's for 1, 6, and alpha. Now, when you hear interleukin 8, let me use a different color. So when you hear interleukin 8, just like C5a neutrophils, okay, if you hear interleukin 8, the only cell I want you to think of is neutrophils. So it and C5a are the two that stimulate neutrophils. So if they give you a question, they ask you about pus. When you hear pus as well, pus, bacterial infection. I'm giving you tickers now. Pus, bacterial infection, all right? So they tell you if someone has a cut in the leg, after a time there was a swelling, or someone had a bar fight, he punched somebody and then he had a wound, a cut, and then a few days later that wound started, it was swelling around the wound, and then with erythema, pain, and all of that, and then after some time it started oozing pus. All right. Once you hear that bacterial infection, or with or without pus formation, neutrophils are almost always involved. And once you hear neutrophils, interleukin 8, C5a, interleukin 8, C5a. All right. So they are the ones that will stimulate neutrophils to go to that site. And when you hear pus is dead neutrophils, the bacteria, and cells, normal tissue cells. So the neutrophils go there like they're like suicide soldiers. Soldiers, if there's a term like that, suicide soldiers. They never retreat, never surrender. So once they get to that side of infection, they are not retreating. Not like the macrophage that will say, okay, once it fights, gets there, battles, it can go back to the lymph node with some information to tell CD4 that, okay, look, I've encountered this pathogen, I need more help. And then CD4 will recruit other white blood cells to go to that side. The neutrophils don't back down. They'll die there And as they are dying, they are releasing all their arsenal as well. So they release all the toxic enzymes and free radicals that they came to kill the bacteria with. So they will die, the bacteria will die, and has caused a lot of collateral damage as well. The normal cells will also die. That's what causes pus. All right. So when you hear bacterial infection, with or without pus, think of neutrophils. And when you hear neutrophils, the things that will stimulate, cytokines that will stimulate them, interleukin 8, C5a. All right. Interleukin 8, C5a. So that's just for neutrophils. Now, when you hear interleukin 12, right? When you hear interleukin 12, like I said, it's one of the main cytokines that are involved with TB. All right. It and interferon gamma. All right. It and interferon gamma. So let's see. Let me show you. Let's see if I can show you how that interleukin 12 works. So there it is. So see, look at interleukin 12 there. All right. So TB, the pathogen. So see your macrophage right here. So the mycobacterium has come in. The person has inhaled it because that's how a mycobacterium is spread via aerosol. Okay, so the patient inhales it, gets to the lungs. Your alveolar macrophage will pick it up, take it to the lymph node. All right, we'll take it to the lymph node over here and present it to your CD4 positive T cell, and then secrete interleukin 12. What's this interleukin 12 for? To activate the naive T cell to become a Th1 cell. All right. This interaction is extremely important, very high yield for your step one. Okay. So it's doing what the work of an APC. Besides trying to kill the pathogen here, when it's overwhelmed by that process, it takes it to the lymph node to meet CD4 for help, so that CD4 will help it to get rid of that pathogen. So once it presents the antigen here via the MHC2 receptor on its surface, it also produces interleukin 12 to stimulate the naive T cell. And once the naive T cell becomes a Th1 cell, okay, that Th1 cell will now in turn produce interferon gamma. So this one produces it to stimulate interleukin 12 to stimulate the cell. The activated Th1 will produce interferon gamma. So it's like tit for tat. You scratch my back, I scratch yours. All right. Now the question, this is very, very important because you can have a question that will ask you, okay, what happens if the Th1 is unable to respond to your interleukin 12? If this interleukin 12 can't stimulate your Th cell. If that happens, then your Th cell will never become your Th cell will never become the naive T cell will never become your helper Th1 cell. And if it never becomes Th1, this will never happen. To never produce interferon gamma. Okay, to never produce interferon gamma. And if it doesn't produce, then the macrophage doesn't get activated, and therefore it cannot go on to kill the bacteria. So you don't. So everything here, nothing happens here. All this stuff stops. So there's no granuloma formation, no killing of the microbe, no Th1 cell. All right. And as a matter of fact, you won't even have a positive PPD reaction, a reaction to PPD. And why is that? Because your Th1, the receptor for interleukin 12 is defective. So it cannot respond to interleukin 12. I'm taking my time to explain it because it's extremely important and very high yield for your step one. So it's something you need to very pay attention to very much and understand that interaction. All right. So that's what we're talking about here. So when you hear interleukin 12, all right, like they said here, it's very important for your TB. Now, other cells that can, as I said, induces T cells to become the naive. So this is for CD4. not CD8. So it induces CD4, the naive CD4 cell, to become a Th1. Remember we talked of differentiation of T cells. Okay, look at it here. So it's this first interaction here, right? It's the first interaction we're talking about here, all right? So you can see it once this is happening in the lymph node, okay? So this is happening in the lymph node, right? So we're talking of this, just this one. So you can see the interleukin 12 produced here. This is coming from the APC, all right? And then it stimulates this CD4 helper cell to become a Th1. Then once this one becomes the naive CD4 cell becomes a Th1, it now produces interferon gamma. So your Th1 is the most important source of interferon gamma. Your macrophage is the most important source of interleukin 12. Okay. So the macrophage is the most important source of interleukin 12. All right. And your CD4 helper T cell, when it becomes a Th1, is the most important source of interferon gamma. Very, very important for you to remember that. Okay. So part of the other things that we said that interleukin 12 does is also stimulates the natural killer cell here that you can see here. Okay, stimulates your natural killer cell. Right. The other ones we talked about was the interferon alpha, beta, I think interferon gamma as well, interleukin 12. Okay. But most important for interleukin 12, remember TB. Interleukin 12, interferon gamma. Once you hear interleukin 12, interferon gamma, these two, just TB, right? That's the number one thing. They can stimulate other things, but the number one thing I want you to remember is TB. TB, just as I said, if you hear interleukin 8, C5a, neutrophils, all right? If you hear fever, sepsis, leukocytosis, acute phase reaction, you think of TNF-1, interleukin 1 and 6, all right? But if they just ask you which one stimulates, of the three of those three, which one is most important for acute phase reaction? Interleukin 6. But the others can do it, but interleukin 6 is the most important one. All right. So, so that's for that. Then moving on. So now we have left macrophage. All right. So we're done with. So we're done with this. So it's, once again, we said if you divide your table into two, all right, if you divide this table into two, you have from the innate, all right, as well source from the two main sources, one innate, two adaptive. The most important cell innate macrophage, most important cell adaptive CD4 helper T cell, right? The ones from your innate, the macrophage, we have interleukin 1, 6, and tumor necrosis factor alpha. Those three almost always go together. They stimulate all the problems, all the side effects of fever and sepsis, acute phase reaction, leukocytosis, insulin resistant, cachexia, and all of that. Via interleukin 8, okay, neutrophils, bacteria, pus, interleukin 8 and C5a. If you hear interleukin 12, TB, granuloma, all right? TB, granuloma. And what's the function of interleukin 12? Stimulates CD4 helper T cell to become Th1, right? So that's for macrophage. And now moving on to T cell. So everything here is T cell, CD4 T cell, right? CD4 T cell. So when you hear interleukin 2 up here, interleukin 2 is like it's like a growth, I would want to say a growth factor. When you hear interleukin, just think of it like a growth factor for for T cells or for lymphocytes generally. It's a growth factor for lymphocytes. Think of it like like a fertilizer for lymphocytes, right? Fertilizer for lymphocytes. So the T cell that has been stimulated, the T cell produces it to stimulate the same T cell to grow and multiply and divide. It's like its own juice. It's juicing itself up. It's stimulating the T cell to. Let's see if I have an image on that. Okay, I don't. Let's find. So the okay. So this is it here. So look at interleukin 2. So interleukin 2, the cell that has been activated, once it's activated by CD4 T cells here, all right? Once the naive T cell has been activated, this is now the activated cell, okay? This is the activated cell. This is the naive cell. So once that's accepted, the antigen is presented to it and becomes activated here, okay? It starts producing interleukin 2. Why is it producing the interleukin 2? Interleukin 2 is to make it produce multiple clones of itself. So it's doubling and tripling, quadrupling in numbers. Okay. So it's forming like a clone. It's cloning itself. That stimulated T cell begins to clone itself, begins to make multiple members of that clone, of that stimulated cell. And then that clone or that gang of that it now divides into multiple copies of itself to form a gang of activated T cells. So this one cell, all right, can divide to become maybe 10 or 20 cells. All right. 10 or 20 cells. Okay. And then these 10 or 20 cells or more will now separate themselves into two groups. All right. Will now separate themselves into two groups, the memory and the effector T cells. So these are the effector ones are the ones that go out and start stimulating cytokines to stimulate other white blood cells. It's the one that carries out the job of recruiting other white blood cells. And then the memory cells will be the ones that stay back in the lymph node. And the next time the pathogen comes, it will now, these are the ones that will be stimulated. Because these effector cells, once they are done with their job, most of them will die off because the stress of recruiting, producing so many cytokines and recruiting a lot of white blood cells and trying to fend off the infection, like you can see here, right? So once the effector T cell, it will go out, you can see here, it's going to go and stimulate other white blood cells. All right. So all this whole process of recruiting and getting rid of the infection, it will exhaust the T cell, okay? And the T cell, those effector T cells will die off. But then these memory T cells will remain behind. They didn't go out to fight the infection. And once the pathogen comes back, it will be there waiting for it. These are the memory T cells will be the ones that will be activated to fight that infection. So all of that is the job of interleukin 2. Interleukin 2 is the growth factor of lymphocytes. Okay. So you can think of it as the one that stimulates the T cells to keep growing and multiplying. So that's what it does. Stimulates growth of all the lymphocytes, just lymphocytes. Growth factor for lymphocytes. That's what interleukin 2 is. All right. Now, when you hear interleukin 3, all right, think of bone marrow. All right. Interleukin 3 stimulates the bone marrow. It doesn't stimulate it stimulates the specific cell, but just think bone marrow. And why is it stimulating bone marrow? So that the bone marrow will produce all the white blood cells. That's what is responsible for your leukocytosis. When you have an infection, all right, what's going on in infection? The pathogen is running wild. The neutrophils are going there and dying off. They have to be replaced in more in numbers, excess numbers capable of getting rid of that infection. And that's what happens. So when you do a blood test in a patient that has fever, anorexia, weight loss, all of those things, you see elevated white cell count. And then you now look at that, you say, oh, white cell count is elevated. What's causing that? Part of the things is interleukin 3. We also said the other three musketeers that go together. 1, 6, and tumor necrosis factor alpha. They also stimulate leukocytosis, but interleukin 3 also does that job. Okay. So when you hear this, you just say this is G, that is just it acts like a colony stimulating factor. So anytime you hear colony stimulating factor in hematology, say it's a substance that stimulates the bone marrow to produce cells, okay, blood cells. That's what the colony stimulating factor is. So interleukin 3 acts like a colony stimulating factor. And what's it doing? It's stimulating the bone marrow to produce white blood cells. That's what it does. Just that's all this one interleukin 3 is. So 2 stimulates lymphocytes, 3 bone marrow. All right. Now coming on to, like I said, if you when you said TH1, okay, we talk of TH1, TH2. All of this is still coming from your CD4 positive T cells, like we mentioned before, right? CD4 positive T cell. And we said your TH1 is the most important source or producer of interferon gamma. Of interferon gamma. Anytime you hear interferon gamma, TH1 cell produces it. And what's it most important for? TB. All this granuloma formation I'm talking of here, TB. So interleukin 12, interferon gamma, TB. All right. And what's the thing that you see in TB that they will test you on? Granuloma. Okay. Another condition unrelated to TB that they talk about is sarcoidosis, but that one is when we get to another condition, I think musculoskeletal or what other, we'll talk about that. Okay. But when you hear interferon gamma, so sarcoidosis is not involved with these ones. Please don't get it. Or let me forget sarcoidosis. Just think TB, granuloma, TB. All right. Don't think of sarcoidosis. Forget sarcoidosis. Think of just TB. When you hear granuloma, the most important thing associated with granuloma for your step 1 is TB. There are other things, but we'll talk about that when we get to it. For these cytokines, TB. And what are the 2 cytokines that are involved? Interleukin 12 and interferon gamma. All right. And the most important, interleukin 12, we said from the innate macrophage. Interferon gamma, TH1 or activated CD4 positive T cell. All right. So interleukin 12 coming from the macrophage to stimulate the CD4 to become TH1. Once the CD4 is activated, it produces interferon gamma to go and stimulate macrophage. The macrophage will produce this to stimulate that. So it's a tit for tat. You scratch my back, I scratch yours. The macrophage comes to scratch the CD4 positive T cells back. When the T cell positive T cell becomes activated, it in turn scratches the activated macrophage, and then the macrophage can go back to form this granuloma, which is supposed to kill the TB. Right? So, like I said here, it's secreted by the T cells in response to the interleukin 12 from the antigen. So, and then stimulates the macrophage to go and kill the phagocytized pathogen. So once the CD4 positive T cell becomes this TH1, it doesn't produce. So when we go back to what they are saying here is inhibits the differentiation of Th2 cell. What it's just talking about here means that once whatever stimulus is given to this naive CD4 hepatocyte cell, whatever line it stimulates, whether this one, or this one, if it becomes this, then all these ones will be inhibited. If it becomes this one instead, if it becomes the Th2, all right, then it will no longer become this other ones. All right. And if it becomes Th17, all right, if it becomes Th17, okay, then it will no longer become these other ones. So it will pick one line and go to that, differentiate into that, depending on the stimulus that is presented to it. So like we said, if it's TB, that is, the patient inhales TB, the macrophage All right, picks up the TB antigen and presents it to your CD4 helper T cell. Presents it to the CD4 helper T cell. This color is too dark. Okay. All right. Presents it to your CD4 helper T cell, right? If it's TB, then it will definitely go up here. All right. If it's if it's an allergen that it picks up, all right. If it's an allergen that it picks up, when we say an allergen is an antigen that stimulates an allergic reaction. Then it becomes this. It will no longer become this or this or this. If it's a bacterial infection that it's involved, all right, a bacterial infection, then it will become this because it stimulates neutrophils here. All right. If it becomes, if it has to do with, if it's trying to suppress an inflammatory response, trying to bring a immune response to an end, then it becomes this because it suppresses immunity, right? So once it becomes this, it can no longer become this or that, this one. So it picks one out of the four to become. It cannot become any or all of them together at the same time. So if so, like we said, if it's an allergen, so if you look at this, for example, all right. Uh, so like we said, the Th2 now, we see the allergen up here. Okay, see the allergen up here. It's picked up by the dendritic cell, presented to the naive T cell. That naive T cell now differentiate to become a Th2 because it's an allergen that was presented. So once it becomes this Th2 here, all right, once it becomes this Th2, all right, it will no longer become any of these other three. All right, so the allergen has stimulated it to become this. And that's what this diagram is showing you here. All right, so the allergen has been picked up, presented to it. It now in turn stimulates the B cell to produce immunoglobulin E, to undergo class switching to immunoglobulin E. All right. Then the immunoglobulin E is what goes and sits on top of the mast cell. And then the next time on repeat exposure to the antigen, you see cross-linking here. Okay, when you say cross-linking of the receptors, okay, on the mast cell, and then it degranulates to release mediators that cause all the symptoms of type 1 hypersensitivity. So we'll get to this, right? So I'm just trying to explain that. The cytokines that are produced by the different Th1 cells, there are different cytokines produced by the different activated CD4 helper T cells, right? So if it's Th1, right, Th1 in the presence of TB, you're talking of interferon gamma, all right? Interferon gamma. Now, if it's Th2, this happens in the presence of an allergen or in allergic reactions. You're talking of interleukin 4, 5, 10. Okay, I think there's interleukin 6 as well, but 4, 5, 10, just 4, 5, 10, and 13. 4, 5, 10, 13. These are the ones that are produced by Th2, involved in allergic reactions or type 1 hypersensitivity reaction. So you'll be talking of asthma. So the conditions that you find Th2, you're talking of asthma, all right? Allergic rhinitis, atopic dermatitis, to name a few, all right? Eczema. So those are the ones you have Th2 cells, Th2 CD4 positive cell predominantly. You're talking of here TB. That's where you have Th1 most predominantly, all right? And then the other thing of other conditions that involve Th1, like I said, class switching of B cells to produce IgG. Here you have class switching to produce IgE, most importantly, okay? So when you hear 4, 5, 10, 13, you're thinking of allergies. And we said, and the other thing I'll mention about Th2 is when you hear Th2, All right. Think of allergic reactions and parasitic and parasites. Right. Allergies, parasites, and then what's the most important? White blood cell, eosinophils. And then what's the most important immunoglobulin? E. So these four things I want to remember when you hear Th2. All right. When you hear Th2, you see it in allergies, parasites, the white blood cell most commonly involved here, eosinophils, and the immunoglobulin E. All right. Immunoglobulin E. Now, of all these ones from Th2, I'll give a special, and then of course IgA is also there. IgA is also there. Look at IgA over here. So there's class switching for IgA. So particularly interleukin 5. So here there are some few special mentions I'll talk about. So for interleukin 5 stimulates eosinophils, right? It also stimulates the B cell to produce immunoglobulin A, right? So for Th2, think of eosinophils, IgE, IgA, all right? IgE, IgA, eosinophils, all right? Parasites, allergies, okay? And then we said earlier that IgA what protects mucosal surfaces against infections, all right? Protects mucosal surfaces against infection. Okay, so that's for interleukin 5. Now, this interleukin 10, when you hear interleukin 10, of all the cytokines we've mentioned on this table, all right? Of all the cytokines we've mentioned on this table, what do they all do? They all stimulate some form of inflammation, whether it's against bacteria, whether it's against TB, whether it's against parasites, whether it's an allergy. It's all some form of inflammation. They're all involved in inflammation, except this one. Let me use a different color, right? Except this. And so when you hear TGF, transforming growth factor beta and interleukin 10, they are anti-inflammatory. There are other ones, but for the sake of your what do you call it, for step one, there are two important anti. So every other thing you see on this table stimulates some form of inflammation, whether it's against bacteria, against parasite, against TB, against cancer, against whatever. Okay, against whatever. But these two, right, I can see here, they are anti-inflammatory. So they would, what would they do? They would dampen the immune response. That's all you need to remember. They are dampening the immune response. Okay, so they are produced by either the Th2 or regulatory T cells. But all you need to remember about of all the cytokines, only two, there are two most important ones that are anti-inflammatory: interleukin 10, transforming growth factor beta. All right, interleukin 10, transforming growth factor beta. And what do they do? So when you hear this TGF, remember I said, so TGF, there's TNF. This is tumor necrosis factor. TGF, this T is transforming, from the word transformers or transformer from NEPA. Okay, transforming growth factor. Transforming growth factor, right? Transforming growth factor beta. For the T is tumor necrosis factor. All right. Tumor necrosis factor. All right. So those are they are different. They are not the same terminologies. Okay. And then another thing that this, besides attenuating or dampening the immune response, when we get to wound healing in pathology next week, TGF and interleukin 10 are also involved in wound healing, which I didn't talk about here, but I'm just giving you preambles for next week. So TNF and interleukin 10 are involved in wound healing. So that's that. And so those are the things you need to remember. So for the every other thing else, all the other cytokines that you're seeing on this table, they are involved in inflammation one way or the other. But these two, interleukin 10, transforming growth factor beta, no inflammation. No inflammation. They are anti-inflammatory. So if they tell you interleukin 10, anti-inflammatory, TGF beta, anti-inflammatory. All right. And then we said earlier that if you divide this table into two, all right, we have they are produced by both the innate cytokines are produced by both the innate and the adaptive. For the innate, macrophage, adaptive, T cell, CD4 T cell, right? From the macrophage, interleukin 1, 6, TNF alpha, interleukin 12, and interleukin 8. 1, 6, TNF alpha go together. Do the three musketeers do almost everything together, right? One for one for one, okay? Or one for all for one, all right? The three of them. Then when you hear interleukin 8, neutrophils with C5a, interleukin 8, neutrophils. When you hear interleukin 12, TB, right? When you hear interleukin 12, TB. Now for the T cells, which is a CD4 T cell of the adaptive arm. 2, when you hear interleukin 2, growth factor for lymphocytes. It's a food, it stimulates lymphocytes to grow, multiply, and increase in numbers. When you hear interleukin 3, growth factor for bone marrow, stimulates bone marrow to increase white cell or blood cell production, right? As you can see here. Then if you hear, then the ones produced by the different types of activated CD4 T cells. So Th1 produces only one, interferon gamma, is the most important source of interferon gamma. What is the important function of interferon gamma? Interferon gamma, TB, right? When you hear interferon gamma, TB with interleukin 12, they are dealing with TB, okay? When you talk of Th2, Th2, CD4, Th2 cells are from CD4, activated CD4, due to what? Allergy, parasites, right? So when you hit Th2, four main cytokines, interleukin 4, 5, 4, 5, 10, 13. Then that's involved in what? Parasites, allergy. Okay, you have immunoglobulin E there, immunoglobulin A. All right, you have eosinophils involved as well. All right, and then, but of all these ones, interleukin 10 is anti-inflammatory as well as transforming growth factor beta. So these two are anti-inflammatory. Okay, so that's a summary of that. So any questions?